October 1st is Urticaria Day. This patient lecture is made available by the Urticaria network. Urticaria is a disease characterized by wheals, itchy wheals, and or angioedema. Here you see on the left side typical wheals, and on the right side swelling, angioedema of the lips. Many patients have both signs. You can see the wheals on the left and the angioedema, the swelling, in the same patient on the right. Wheals can appear anywhere on the body's surface. Angioedema is mostly located in the face. It can hit anyone, kids, adults, at any age, but women are affected twice as often as men when it comes to chronic spontaneous urticaria. Urticaria is very common, and 1 out of 4 will experience urticaria at one point during his or her life. Fortunately, in most cases, urticaria is acute. That means that the symptoms only appear for 6 weeks or less. But in some patients, and that's up to 1% in the general population, acute urticaria becomes chronic. It lasts for longer than 6 weeks, sometimes years, sometimes longer than this. And it comes with inducible or spontaneous whealing. On the left you can see symptomatic dermographism, where scratching of the skin is required for wheals to occur. In contrast, on the right, the wheals and the swelling come spontaneously, without the influence of an external trigger. Humans are not the only animals that can experience urticaria. It is also seen in horses, pigs, dogs, and others. What you see here is a wheal looked at from the side. You can see the superficial swelling of the skin and the redness around this swelling. Now, in the middle of this swelling, the skin is white because the fluids that come from the vascular system, from the blood vessels, they compress the blood vessels, and therefore there's less blood in that part of the skin. When you look at what happens in the skin when wheals occur and also angioedema, then mast cells are the most important cells. These cells are located in the skin but also in other tissues, and during the onset of wheal development, it is these cells that, because they become activated, release histamine and other mediators that then result in what we perceive as itchy wheals. Now this happens because mast cells talk to sensory nerves in the skin, seen on the right, and blood vessels. What happens when mast cells get activated is that the mediators released from these cells, they go to the sensory nerves and activate these sensory nerves, and the result is itchiness. That is the signal that goes to the brain. And the second thing that happens is that the mediators released from mast cells, they go to the blood vessels, and they make these blood vessels leaky, so that what is supposed to stay inside the blood vessel comes out. And that's mostly water, that's why it's an edema, but also some other cells that you can then see in the skin after cells have degranulated. Now this superficial edema in wheals, or deeper edema in angioedema, lasts either for a couple of hours, as is in the case of wheals, or several days. And it is due to many factors released from mast cells, most prominently histamine, which is also the reason why antihistamines work in many patients with urticaria. But there are other mediators released from mast cells that contribute to these skin reactions. Now, in some patients with chronic inducible urticarias, an external trigger is required for the symptoms to occur. For example, in cold urticaria, the skin needs to get cold in order for it to develop wheals or angioedema. Or in symptomatic dermographism, scratching is what induces wheals in patients. Other triggers include sunlight or heat or pressure. We call these inducible urticarias physical urticarias. When the wheals and the angioedema occur without external triggers, out of blue sky, if you want, the condition is called chronic spontaneous urticaria. And here we know some of the underlying causes. 1 in 5 patients with chronic spontaneous urticaria develops this condition because they are auto-reactive. Something in their blood, something in their body reacts to something else in the body. Auto-reactivity, or a subform of auto-reactivity, autoimmunity, is responsible for the mast cell activation in these patients. 1 in 4 patients has chronic spontaneous urticaria because there is a chronic infection somewhere in the body, for example, the stomach or the teeth. There's a small infection, and this infection leads to mast cell activation in the skin and the signs and symptoms of chronic spontaneous urticaria. And 1 in 3 patients has chronic spontaneous urticaria because of intolerance reactions to food components. Now, these major underlying causes of chronic spontaneous urticaria can be found, but it is difficult and sometimes impossible to do that. In fact, 30% of patients, even when we look very thoroughly for underlying causes, will remain unidentified for the underlying cause. Let's talk about infection a little. Mast cells are the key cells in protecting us from infectious bacteria. And when bacteria come in contact with us and we have to defend ourselves against these bacteria, then mast cells are essential to the protective response against these bacteria. And what this means is that mast cells are very sensitive when it comes to bacterial signals, so they will become activated very quickly by bacterial signals, but also by signals that we make when we react to bacteria, such as complement or immune complexes. Auto-reactivity, something in the body reacts to something else. Some patients have autoantibodies, antibodies that bind to skin mast cells and activate these skin mast cells. And these autoantibodies circulate in the blood of these patients, and whenever some of these antibodies come from the bloodstream to the skin, mast cells get activated. Now, this can be tested with the so-called autologous serum skin test. And the way this test is done is a little bit of blood is collected, the serum from the blood is obtained, and then injected into the skin of patients. And in those patients where there is something in the serum, in the blood, that activates skin mast cells, a wheal, just like in urticaria, can be seen at the site of serum injection. The test proves, if positive, that patients are autoreactive. Intolerance is a little bit more difficult to diagnose. Basically, it is many food components, not allergens, but additives and natural compounds that patients with chronic spontaneous urticaria react intolerant to. And this can only be verified by patients keeping to a very strict diet that eliminates all these food components that are known to affect the degranulation of masts. In fact, recent studies have shown that about 1/3 of patients with chronic spontaneous urticaria will show improvement when keeping a diet that is free or low for food components that cause intolerance reactions. And this can be measured with the Urticaria Activity Score as shown here, UAS, where patients document daily the number of wheals and the intensity of pruritus, and the diet done with a diet booklet, will result in the disease activity, the urticaria activity score, going down. So yes, in patients with chronic spontaneous urticaria, underlying causes can be found, but some patients, even though they're investigated, will remain chronic spontaneous urticaria patients due to unknown causes. How do we treat chronic urticaria, chronic spontaneous urticaria? First of all, we have to say that the aim of treatment, the goal that we want to achieve in the treatment of urticaria, is the complete control of symptoms. We want no more wheals, we want no more itch, we want no more angioedema. And if we can't take away the underlying causes, then what we can do quite well is take away the symptoms, prevent the symptoms from coming with this three-way approach shown here. Patients with chronic urticaria should receive a second-generation non-sedating antihistamine. And many patients will respond to this, others will not. So once we've waited for 2 weeks and the response is not the way we want it to be, the next step is to increase the dose of a second-generation antihistamine. This increase is safe and effective. So many patients who did not respond to a standard dose antihistamine will respond, will achieve complete absence of symptoms when they take 2, 3, or 4 daily doses of this non-sedating antihistamine per day. The important thing is to do this every day to prevent the symptoms from coming and not to take antihistamines to react to wheals that have occurred. The most effective way to work with antihistamines is to take them every day to prevent wheals and angioedema. But some patients, even with 4 times the standard dose of an antihistamine, will continue to develop symptoms. And these patients should then be treated with omalizumab, anti-IgE, cyclosporin, an immunosuppressive, or montelukast, a leukotriene antagonist. Using the step-up approach, almost all patients can achieve freedom from symptoms. What we don't want is patients to take cortisone. Cortisone long-term has side effects, many side effects, and cortisone should only be used, if at all, for short-term treatment of exacerbation of disease. It should not be used long-term. And creams and gels don't work in chronic spontaneous urticaria if they contain cortisone, so they should be avoided altogether. So let's summarize. Chronic urticaria is a common disease. 1 in 100 people right now have chronic urticaria. It is an annoying and debilitating disease, and we know that many patients with chronic urticaria suffer severe quality of life impairment. In chronic urticaria, chronic spontaneous urticaria is the most common form. 2/3 of all chronic urticaria cases are chronic spontaneous urticaria. And in chronic spontaneous urticaria, it is possible to identify underlying causes, infections, food intolerance, or auto-reactivity, in some but not all patients. And in patients where these causes can be taken away, that should be done. All other patients will benefit from symptomatic treatment. Antihistamine, standard dose, antihistamine in higher than standard dose, and more effective treatment with omalizumab, cyclosporin A, or montelukast. Let's celebrate Urticaria Day. Let's talk about this disease. Let's raise some awareness. Let's make people think about it and help us to find better ways to manage it and eventually ways to cure this devastating condition.